Rob, the first thing that you need to know about child maltreatment, or what is often referred to as child abuse and neglect, is how incredibly common it is. More than 1 in 3 children are experiencing some type of maltreatment as they're growing up.
Wow, that's, I would think most people would have no concept of how pervasive it is. And maybe you could talk a little bit about, so like, how is that showing up here at the Children's Hospital? What is, how do we see that? How does it manifest itself in terms of the kids who show up here?
So we're seeing it in many ways, and it is still, even though we are doing our best to recognize it, there are still many times where health and social service providers in our own hospital aren't aware of it. So, for example, we're seeing it in children who are presenting with emotional and behavioral problems, children with physical problems, children with complex medical issues, and it's a very hidden problem. What we become aware of is really the tip of the iceberg.
The experience of child maltreatment is associated with one of the most adverse and stressful experiences for children. And what we know is that children who have had such experiences are more at risk of being involved with the criminal justice system, more at risk of being homeless, being unemployed, and also of having chronic health problems. So what we realize is that if we don't address the issues of child maltreatment now, that we're going to pay a lot later as a society for all of the increased morbidity and mortality that will occur subsequent to the effects of child maltreatment.
And is there, it's probably an impossible question to answer, but you know, for a child who has experienced a period of maltreatment, are there interventions that can help to avoid some of that you know, those consequences later in life?
Absolutely, and that's why the importance of identification becomes important, as well as thinking about things that we could do for primary prevention.
So Rob, the third thing you need to know is that the CAP program every year sees hundreds of the most vulnerable children in our region.
So can you just walk me through how typically a child would get into the program? How do they end up here?
Sure, with the medical part of the program that I'm most affiliated with, 85% of our referrals come directly from the Children's Aid Society. So the CAS worker will get a call from a school or a daycare about a concerning mark on a child, or a child may make a disclosure of someone having sexually abused them. The agency worker will call our medical team, a physician that's on call, and discuss that case, and typically we'll see them that same day or arrange a follow-up appointment.
I would think, like from your perspective, that interviewing these kids would be a really acquired skill that in order to make sure, on the one hand, that you're encouraging them to be forthcoming, but on the other hand, you're not sort of leading them in a way to say things that, you know, they wouldn't otherwise say, that you're trying to get to the truth, but it must be very tricky.
That's right. The children in the examination room, when we're seeing them though, can be anywhere from, you know, silent and clearly fearful, sometimes very emotionally flat, to surprisingly resilient and effusive and funny and silly and everything in between. One little girl came to the clinic covered in bruises with a packed suitcase that she'd taken to school because she was planning on not going home. And that's one that I'll remember for a long time.
That's very tough.
Yeah.
Yeah. So I thought it was really powerful meeting with folks from our child advocacy and assessment program today. You know, shocking to me that fully 1/3 of kids experience some kind of maltreatment over the course of their childhoods. Also really shocking that those experiences for kids tend to result in lifelong impacts in terms of illness and disease and behaviors. So it is an area that I think really merits some investment by our society, because it'll have big impacts going forward. It's heartening to know that CAP sees hundreds of kids every year in kind of a strange way, because it for sure signals the magnitude of the problem, but it's also nice to know that we've got such a strong team of professionals who are here for these kids who are incredibly vulnerable and who are experiencing really awful things. As much as we saw 3 physicians today, I know that there are lots of different professions at work in CAP, psychologists and social workers, in addition to all of our partners in the community, teachers and child protection agencies and police and so on. So, you know, it's a stunningly big problem, but here at the Children's Hospital, I think we're making a big difference in the lives of these kids who really need somebody watching out for them. So that's it for this segment, and we'll see you next time.